To tell us more, I'm joined by Onesisa Mtwa, who's the Innovation Manager at DG Murray Trust. Good evening to you and welcome. You are pushing for a much stronger regulatory environment than we currently have. Share why the timing is urgent and the neglect of legislation questionable.
Sure. Thank you very much, Iman, for having me this evening. The DG Murray Trust is a trust that is a public innovator that is invested in seeing South Africa becoming a flying nation. And alcohol emerges in many of our interventions as a stumbling block for many of the goals that we are pursuing in enabling South Africa to become a flying nation. And we've seen in recent news in the Enyobeni Tavern and other very tragic events, the impact of poorly regulated alcohol. The Liquor Amendment Bill, in fact, doesn't provide for minimum unit pricing or trading hours, but we as the DG Murray Trust are advocating for it to be improved with those. What it does have is very stringent restrictions on alcohol advertising, tangible regulatory provisions for stricter licensing systems, the prevention of sale of liquor in petrol stations and at least 500 meters from schools, places of worship, residential areas, and rehabilitation and treatment centers, as well as increasing the drinking age from 18 to 21. And these levers are particularly important in reducing how easily accessible alcohol is in South Africa, and part of why heavy episodic drinking is so prominent in our country.
We'll come back to what's the reason for the stalling and who then needs to reanimate that piece of legislation or the amendment in the liquor bill. But I mentioned some of the opportunities. You've touched on a few of them now again that are within our grasp to affect behavioral change. Please share more detail on how advertising could be affected and make a contribution to the toxic consumption of alcohol.
Sure. There's quite extensive research and evidence that illustrates how socialization, particularly at adolescent age, makes people predispositioned to drink heavily or to drink excessively, because it changes, it images alcohol as something that is aspirational and less as a substance that is consumed carefully and moderately. And so this is the way that advertising images portray alcohol consumption, encourage and stimulate the desire to drink excessively. And countries that have had success in restricting advertising have seen a decrease in consumption, particularly amongst young people. In South Africa, this is relevant because the population that drinks the most excessively is the 18 to 25 age group. And so advertising really contributes to how young people particularly perceive binge and heavy drinking and how it becomes a part of your behavior as a person.
Yeah, I mean, there was a whole webinar that you were a part of together with other partners that really talked about, these pathologies of behavior that are really engraved in this age group that you're just talking about, which promote sort of long-term abuses in the way alcohol is consumed. So I encourage people to go and have a look at that. But what about minimum unit pricing? How would that work?
Sure. So minimum unit pricing is a system that's been particularly successful in Russia and Scotland. Russia and Scotland are the only two countries that are above us in terms of rates of heavy episodic drinking. And what it does is that it introduces a standard minimum unit price per unit of pure alcohol in an alcoholic beverage. And it's mostly implemented at a retail level such that it doesn't impact the manufacturer as intensively, and the retailers are sort of protected by the decrease in consumption, but the simultaneous price increase. And what it does is that it prevents alcohol from being extremely cheap. An example that I can make is that if a unit of a standard a beer drink that is a 33 ml can has, let's say, 12 milliliters of pure alcohol, if the state sets a minimum unit price that says it's 10 Rand minimum unit price, that means that can cannot be sold for less than that, and all other costs from the manufacturer to profits to VAT that the retailer calculates have to be added on top of that price. And often then that drastically changes the price and discourages consumers to buy excessively.
We'll loop back to the architecture of deterrence, which is what you're talking about now. Let's just add one more point in, the regulation of points of sale and customer. And this seems to be the one that society is most ardently calling for, but it needs bodies on the ground. How do you get the enforcement going?
Sure. I mean, firstly, the legislation has to be clearly defined, and this is why we're calling for the Liquor Amendment Bill to come back on the table, to be reviewed, to be written and crafted well, and for the National Liquor Policy then to follow suit. And then the liquor boards and the enforcement that is attached to that then needs to be really strengthened and structured well. But neither the police services nor the liquor boards can do anything about enforcing legislation that isn't clearly written. So it's a combination of both that really need to be structured well and structured carefully in how the legislation and the policy is designed and the implementation process is planned.
The interesting thing about everything that you're saying is that it really depends on that structure of law, that is where the responsibility lies, to make sure that the burden of behavior and responsibility in a way is taken away from people who are considered to be the end users. What's standing in the way of this legislation right now, very quickly, and who needs to unblock it?
Sure. I mean, firstly, alcohol legislation is a whole of government issue. While it affects the health and social development sector departments quite heavily and costs them heavily, there are various departments that regulate, such as DTI, such as agriculture. And so it needs not just one government department, but multiple government departments to really come to the table and work cohesively in consultation with communities and the public to ensure that this bill is reopened for public comment and goes back to Parliament. And so we're an independent civil society organization, and we don't have the inside information on where exactly in the state is this blockage happening. But we're calling for the state particularly, and even more so the presidency, to really take action in ensuring that there is a intergovernmental process that gets this bill improved and gets it over the line, to reduce the heavy burden of alcohol on the state and on our society and on our economy.
Yeah, we certainly hope that some of these tragic developments over the last couple of weeks galvanize action around this becoming a reality in the way that you foresee it. Anisisa Mtwa, thank you for talking to us. She is the Innovation Manager at the DG Murray Trust.